Hey there, cat lovers. If you've got a cat, you know they are masters of hiding when they're not feeling well. So today we're going to talk about something super common. One of the biggest reasons cats end up at the vet's office, trouble with the urinary tract.
So, have you noticed your cat maybe spending a little too much time in the litter box? Or maybe they're avoiding it completely? I know, it's super worrying when you see that. But don't panic. The best thing you can do is understand what's going on. And that's exactly what we're going to do here. We'll go over what could be happening, the key signs to look for, and what your vet can do to help your little buddy feel better.
All right, first things first. You're probably going to hear your vet use a specific term, FLUTD. So what on earth is that?
Okay, so FLUT stands for Feline Lower Urinary Tract Disease. But here's the really important part. It's not one single disease. It's more like an umbrella term. It covers a whole bunch of different conditions that can mess with a cat's bladder or their urethra, that's the tube urine comes out of. So when your vet mentions FLUT, they're really just describing the problem area, not the specific why just yet.
I found the easiest way to think about it is to picture the plumbing in your house. Seriously, a cat's urinary tract is just a system of pipes for getting rid of waste. And FLUTD, well, that's just a catch-all term for any problem with that plumbing. Could be a clog, a leak, some irritation in the pipes, anything that stops things from flowing the way they should. So what's actually causing these plumbing problems, and are some cats more likely to get them than others? Let's dive into that.
Okay, this part might actually surprise you. You'd think the number one cause would be something obvious, like a bladder infection, right? Well, for cats under 10, that's usually not the case. In fact, in about 65% of cases, that's nearly 2/3, the culprit is something called Feline Idiopathic Cystitis, or FIC. Now, idiopathic is just a fancy vet term that means we don't know the exact cause. It's basically inflammation in the bladder for no clear reason. But what we do know is that stress is a huge trigger for it.
When you look at the risk factors, a pretty clear picture starts to form of the typical cat who gets this. We're often talking about middle-aged cats, maybe a little on the chubby side, who live exclusively indoors and don't get a ton of exercise. Diet plays a big role too, especially a dry food-only diet, because those cats just don't drink enough water. And, connecting back to that FIC we just talked about, stress is a massive one. I mean, anything from moving furniture around, to a new baby, a new pet, or even just some squabbles with another cat in the house, it can all set things off.
This is where you come in. You're the one who sees your cat every single day, so you're truly the first line of defense. Let's go through the exact signs you need to be looking for, the ones that mean it's time to pick up the phone and call your vet.
All right, these are the classic red flags. You might see your cat making trip after trip to the litter box, and they're straining, but only a few drops come out, or maybe nothing at all. Sometimes they'll cry out when they try to go. It's clearly painful. You might even see blood in the urine, which looks kind of pinkish, but honestly, the biggest giveaway is when your perfectly potty-trained cat suddenly starts peeing in weird places. Think the bathtub, the sink, on cool tile floors. They're not being bad. They're associating the litter box with pain and are desperately trying to find somewhere else that might feel better.
Okay, I need you to listen very carefully to this next part. This is critical. If you see your cat straining to pee and absolutely nothing is coming out, this is a life or death emergency. I'm not exaggerating. This is what we call a blockage, and it's most common in male cats. It is excruciatingly painful for them and can be fatal in as little as 24 hours. Do not wait to see if it gets better. Call your vet or the nearest emergency animal hospital immediately.
Okay, so you've seen the signs, you've made the call. Deep breath. Knowing what to expect at the vet's office can make the whole thing a lot less stressful. So, let's quickly walk through what's likely to happen.
So your vet is going to play detective here. First, they'll want to hear everything from you, all the little details you've noticed. Then they'll do a physical exam, which usually includes gently feeling your cat's belly to check on the bladder. The next, and probably most important step, is getting a urine sample for a urinalysis. That one little sample tells us so much. We can see signs of inflammation, crystals, blood, infection. It's a goldmine of information. And if they suspect something more solid like bladder stones, they might suggest an X-ray or an ultrasound to actually see what's going on in there.
And here's the really good news. For the vast majority of cats, FLUTD is totally manageable. Getting the diagnosis is step one. Step two is putting a plan in place to make sure your cat has a happy, comfortable life moving forward.
Right, so when it comes to managing this long-term, it's almost never about just one magic pill. We take what's called a multimodal approach, which just means we tackle the problem from a few different angles at once. First up, diet. This one is huge. Just switching from dry to wet food to get more water into them can be a total game changer. Then there's their environment. We need to reduce stress, right? So that means things like adding more litter boxes. The rule of thumb is 1 per cat plus 1 extra. Making sure they have plenty of playtime, maybe even using puzzle feeders. And of course, there's medical support. We'll often use things like pain medication to make sure they're comfortable while all these other lifestyle changes start to work their magic. So if there is just one thing you take away from all of this, please let it be this. Your eyes are the most important diagnostic tool we have. Seriously. Noticing those tiny little changes in your cat's behavior and acting on them quickly, that is the absolute key. When we catch this stuff early, it is so much easier to handle, and we can get your cat feeling better in no time.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.